Yeah, this is your card.
Yes, sir.
Yes, you can start now.
Okay, sir. Good afternoon. I am Dr.
Good
Keval.
afternoon, doctor.
Yeah, I am Dr. Keval, one of the doctors working in this clinic. And as I can see from your case notes that a few days ago, you brought your child into the emergency department with severe bouts of coughing, some breathing difficulty and wheezing. So as he was diagnosed with asthma, so may I know what brings you in here today?
Yeah, actually, I am worried about my son. Okay, let
Yes.
me introduce myself. I am Lily, and I have brought my 5-year-old boy. He was diagnosed with asthma, and I don't know what exactly it is. My son's, yeah, and he was there here for some days, and yeah, a couple of days ago, yes, and then I can tell you his asthma has not been very bad. He has had one attack since he was diagnosed at the emergency department, and he used the inhaler and the spacer that were given to him. Yeah, they were given by the hospital, and they helped the symptoms. That is what I can tell you.
Okay, so you are just here for the follow-up of his condition, as far as I can understand. So before proceeding further, I would like to ask some questions that about your family history. Is that okay with you?
Yeah, of course, doctor.
Okay, okay, Lily. What is there any family history about asthma or eczema, hay fever, something like this?
Yeah, actually, the thing is, yeah, no one in my family has asthma or eczema, but I usually get mild hay fever in the summer.
Okay, so it's good to know. Thank you. Thank you for answering my questions. Also, now I would like to discuss about the possible triggers which can happen, resulting in the one of the attacks of your child's asthma. So, may I proceed about the possible triggers?
Yeah, of course, doctor.
Okay, Lily. So the possible triggers can be because of the cigarette smoke, or it can be because of the dust mites, pollen. Also, when your child is doing some strenuous activity or physical activity or playing, which includes running, also cold air. Is there anything like this happening with your child? Can you please let me know?
Yeah, my son, yeah,
Yeah.
he's normally fine, and there is no one in my house who smokes, and
Okay.
the house is really clean. I think he has attacks after he has been running about outside, maybe in the garden or somewhere.
Okay, that's good to know. Yes, that might explain one of the possible triggers, uh, which can be causing your child's condition, that is asthma. Also, may I know that what do you know about your child's condition, that is asthma?
Yeah, I do not know much about it, but if you can tell me, I can, yeah, picture it out.
Okay, thank you for asking me. I am happy to help you. First of all, asthma is a chronic lung condition in which there is a tightening or the narrowing of the muscles in the airways, and also which can result in the swelling or inflammation, and which in turn can produce extra mucus. Also, this condition can be because of some risk factors like, as we discussed earlier, family history of hay fever and etc. Are there any other further concerns that needs to be addressed, Lily?
No, doctor, but I find this one very, uh, yeah, problematic. I am little bit worried, and
Okay.
yeah, I am not sure because I found the diagnosis really overwhelming, and I am not sure how I am going to be able to help him manage his asthma.
Okay, Lily, I can understand in what type of pain you might be, but I would like to reassure you that there is nothing to be seriously worried about your child's asthma. Also, it is quite manageable, and with regular monitoring and with the support available from the clinic, we can definitely manage your child's condition with excellent prognosis. Now I'm going to describe about the management of your child's condition. First of all, what we are going to do is we are going to identify and control all the triggers which are resulting in your child's asthma attack. Is that clear?
Yeah, of course, doctor.
Okay, Lily. Also, furthermore, what we are going to do is we are going to assess the severity of the symptoms. And as soon as you find that your child is experiencing any new symptom or a severity in the previously experienced symptoms, then you can immediately call us on the given number, and we are happy to help you 24/7. Also, I'm going to write you some possible triggers or the possible symptoms which can happen, so that you can keep it in your child's pocket, and wherever your child is going, so the people around him might know that what he might be going through right now, and can provide him with urgent treatment. Is that all good, Miss Lily?
Um, but the thing is, I'm not sure how I'm going to be able to help him. But the thing is, I feel now after your explanation a little bit reassured about managing my son's asthma now. Is there anything else that I should know, doctor?
That's good to know, Lily. I am here to help you and your child in every step of the way. So now, what I'm going to do is I'm going to outline the next steps which we will implement in further managing your child's condition. First of all, I would like to examine your child. So do I have your consent?
Yeah, that's fine, doctor. I'll just go out and get my son so that he can be examined. What do you say?
Uh, yes, okay, that's fine. And also, after examination, we will collaborate in the discussion process together, and we will create a asthmatic action plan. Also, I'm going to discuss the next treatment plans with you, apart from the Ventolin inhaler and the spacer. Also, I'm going to arrange a support group for you, and you are happy to come here anytime if. You are welcome to come here anytime if you experience any worsening of the symptoms in your child. Am I being clear with you?
Yeah, of course.
Okay, Miss Lily. So, is there anything else I can help you with today?
Yes, that's fine. Everything is clear, doctor. Thank you very much for your support. Thank you once again.
That's fine, Lily. Thank you. Take care.
Okay. So, let me give you your feedback a little bit.
Yes, sir.
Right. So, coming to the point, yes, we have done the speaking session. Yeah, that's asthma. Yeah. So, there are some areas which we are going to consider. Right. Keval Shah, medicine, asthma, speaking, asthma attack. Yes. So this is role play is done. Yeah. Okay. So there are some things which you have to consider. The first one is fluency. Now, what is this fluency? Fluency means the flow of speech, continuity of speech without too many pauses and breaks. Some people speak like yesterday. Uh, 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 Yesterday, I I went to the hospital and this is not a fluent. This is not very fluent. So fluency is very, very important. That's what I'm telling you. Fluency is very, very important. If you can manage this fluency, it will be very easy for you. So next, accuracy. Now, accuracy. Now, what is this accuracy? We have to notice. Now, this accuracy. Yeah. See, accuracy means three types. First one is grammar related accuracy, then vocabulary related accuracy, then pronunciation related accuracy. So grammar related accuracy, that means what type of sentences you are using, what type of tenses you are using, is the grammar, coordination, collocation, everything fine or not, grammatical accuracy. Then vocabulary accuracy, what type of vocabulary you are using, perfect vocabulary you are using, or you are confusing with your words, or can you use better words to give a clear picture. Okay. For example, if you say started, it's correct. But when you say commenced, it's even higher vocabulary. Started, anyone, even a fifth grade student can say. But the word commenced is a better word. So, what type of vocabulary? Perfect vocabulary you are using. That's what is important. That is related to vocabulary. Then third one is pronunciation. How nicely we are speaking. Okay. So the way how a native English person has to speak. Are we speaking like that? It's not a problem. But if at least the other person should understand your pronunciation. So be clear and loud enough. Be clear enough to explain what you want to say. So that person is able to understand what you are speaking is important, right? So that should be clarity. The next one, so fluency, then accuracy. The next one is grammar. I told you already grammar, what is grammar, then vocabulary, what type of vocabulary, then pronunciation. The next one is there are many pauses and breaks in your speech. Try to avoid them as far as possible. Better be prepared. Learn variety of sentences and practice them on a regular basis so that you can use them normally, freely, easily available vocabulary. So some sentences. Your concern is quite reasonable. I understand your concerns because they are extremely reasonable. If I were in your place, I would have reacted in the similar way. Undoubtedly. But being a nurse, I know about this condition. This is quite common condition. Trust us. This is not a very serious problem. It can be manageable. The only thing that is changed is he has asthma. So you have to manage the condition. So you are in safe hands. We are going to do everything possible for improving your child's condition. Therefore, there is nothing to be afraid of. So like this, many sentences are there which you can use. Words of reassurance, words of giving comfort, that's what it is. So that's it. The next one, simple, complex, compound sentences. This is related to grammar. So now you can say like this, what? If you are compliant with the medication regimen, dietary restrictions, and exercise regimen, then managing this asthma is as simple as possible. Or you can manage it very easily. You can manage it without any complications. So anyway, you can say 1001 ways they can use. So this if you're using, so it becomes a complex sentence. Complex sentence. So you can make two sentences, join them into one sentence, and make a bigger sentence. So that is relating two sentences. Medication, then management. These two together, different sentences. You can speak them as two different sentences, or you can use them as one individual sentence. I just told you now. Compliance with medication is extremely important. This is one sentence. Managing asthma is possible. So these are two related sentences. If medication compliance is maintained. If, okay, the child is compliant with medication, then managing asthma is possible. So two sentences joined into one simple sentence, complex sentence. So remember that two ordinary sentences clubbed into one particular sentence using the condition if. Otherwise, you can say the opposite also. If you are not compliant with medications, you will have a number of complications. Now, if you talk this negative sentence, the people will be afraid. So avoid talking negative sentences and be positive. Being positive, be positive is my blood group. So make it your attitude. Be positive. Okay. So don't use negative words as far as possible. You will be terrifying or scaring the patient. If you do not follow the recommendations, you will face complications. That means you are threatening me or what? They will think. So be very careful. So these are some suggestions for you. Dr. Keval Singh, Keval Shah. Hello?
Yes,
Yeah,
sir.
you can speak your opinion. What do you feel? Was it beneficial?
Yes, sir. Definitely, it was beneficial. I remember that my first role play before with you was I was bit hesitant to speak. Also, I made so much fumbling, but I think I improved a bit this time, and I'm definitely looking ahead to work on these weaker areas like vocabulary and fluency, and not taking too much pauses and breaks in between.
That's good. So that's the end of this session, speaking session. Then we'll join in the next session.